Hello and welcome to another interesting episode of Health Watch. Like I always say, this is the only program that enlightens and educates you on general health issues affecting men, women, and children. Interestingly, today's topic affects both men and women, but we'll be looking at only the women for today. And we're talking about infertility in women. Our guest today is an infertility specialist. So I'll just say, get a glass of water, grab your paper and pen, because she's going to be saying a whole lot about the causes, the treatment options, and of course, you know that in this climate we have issues with accepting some kind of medical condition. But today you'll be hearing everything you need to, the facts you need to know about infertility. My name is Nkem or Kibi. We'll go on a short break. When we return, you'll meet my guest. Stay with us, don't go anywhere. If you're just joining us, the program is Health Watch, reaching you on the station for Excellence NTA Lagos Channel 10. And our topic today on the program is infertility in women. My guest today is an infertility specialist in the person of Dr. Jane Nwokedi. Welcome to the program.
Thank you.
How are you doing? You look great.
Thank you.
I'm always excited to have you on the show because I know the last time it was really expository.
Thank
so
you.
Welcome to Health Watch.
Thank you.
So when we say infertility, how do we define infertility?
Okay, in layman's language, infertility can be defined as inability to conceive in a couple after 1 year of unprotected sexual intercourse. We are stressing that unprotected sexual intercourse. So unprotected sexual intercourse of up to 5 to 7 times a week in couple for 1 year before you will say the couple are having infertility problem.
You know how it is in the country we find ourselves in. Nigerians are very religious people, so most of the times when they go to the hospital and they tell them you have this, they start to bind and cast. Not that we don't believe in God, but as health conscious people, we should take our health very seriously. So what would you say are the causes of infertility? Or before I go to the causes, is there any sign you see as a woman and you are worried, you are perturbed, you need to see your doctor, that makes you feel like, why am I not getting pregnant? Is there something to look out for?
Yes, there are a lot of things to look out for. Like I said before, that infertility is inability to conceive in couples after 1 year of sexual intercourse, unprotected sexual intercourse of up to 5 to 7 times a week. Now, we'll have causes of infertility. Before we get to that, we'll have 2 types of infertility. We'll have what we call primary infertility and secondary infertility. Okay. In primary infertility, it occurs in a woman that have not conceived before. The woman has not conceived before in her life. So when such thing happen and the woman has been having sexual intercourse with the husband up to 5 to 7 times a week, and the sex is unprotected, and yet she's not able to conceive, and she has not conceived before, you said the woman is having infertility problem. Then the secondary infertility occurs in a woman that has conceived before, maybe ended up as a stillbirth, ectopic pregnancy, or prolonged pregnancy. He has conceived before, and to conceive again is taking her a long time, 5 to 7 years, long time before she's able to conceive. So in such a person, you say she's having secondary infertility. So there are 2 types of infertility, like I said, primary and secondary. Okay. There are causes of infertility. You know, in Africa, they feel when you have infertility is a problem of a woman. But it's not that.
So it could affect both genders.
It affects both genders. Now, most of the men are the main cause of infertility. So we'll have male factor and female factors. So the 2 people can contribute to having the problem, causing the problem of them not being able to conceive.
Doctor, let me get it. Are you trying to say that a couple, the both of them could be a reason why they don't have a child?
Yes, yes.
You mean the man also has,
yes,
and the woman
has a problem
as
too.
a couple?
Yes, it can be the cause. Now, in female, we have what we call, there are factors that can cause infertility in female. First of all, we have your age. People above 35 years. That does not mean that somebody that is 35 and above cannot conceive, but it begins to decline after 35 years. The rate of conception begins to decline after 35 years. We'll have what we call coital problem, like intercourse, the sexual intercourse problem. Some people don't know when they are ovulating. That's another problem. And they don't know when to meet each other. That's why we said they should be having regular sexual intercourse up to 5 to 7 times a week. So with that, they won't be able to miss their ovulation time. If you have up to 7 times every day, you won't be able to miss the ovulation time.
Okay, doctor, sorry to cut in short. I know that a lot of people are watching right now and they might not know what ovulation means. Maybe you should just quickly tell us. When you say ovulation, give us an example.
Ovulation is when a woman is very fertile, ready to receive the semen, the sperm, to fertilize the egg. That's your ovulation period. It usually happens, the ovulation period occurs after menstruation.
Okay.
So for somebody, let me give an example. For somebody that is having 28-day cycle, the ovulation period will be around the 14th day.
Okay.
So the ovulation period differs. That's the problem again. A lot of people don't know that ovulation period must not be on the 14th day.
Okay.
Because the menstrual cycle differs
too.
Some people have 32-day cycles, some people have 28, some people have less than 28. So those are the things the person has to put into play
consideration
before once the doctor sees you, he will ask you all these questions. So we'll have what we call tubal factor. Some women have tubal blockage. Their tubes are blocked. It's one of the causes of infertility. We'll have uterine factor. Some people have fibroid, endometriosis. They are the causes of infertility. Okay? Then we'll have what we call cervical factor. We'll have cervical polyp, cervical incompetence.
That has to do with the cervix.
Yes, it has to do with the cervix. We'll have polycystic ovarian syndrome for ovarian factors. So those things will have environmental factor. Toxins from environments can make somebody to be infertile, like lead. People that work where they have such chemicals, they tend to have problem with fertility.
Can you give us an example?
Like people that work where where they break stones. They have toxins, a lot of toxins coming there. People that work in radiology labs, radiations kills the semen. I will get to that later. So now those factors, and we have what we call diet factor. People that are not eating very well, it affects fertility. Exercise also affects fertility. When somebody is obese, it affects fertility. Underweight, it affects fertility. Overweight affects fertility. All those things affect fertility. We have a lot of them that affect fertility. So when a person sees a doctor, we'll be able to tell the person what is the problem. In male, we'll have a lot of them. Testicular problems. We have testicular torsion. We have men with low sperm counts.
So this particular one you're saying now is a topic for another day because we're focusing on the women.
Okay,
so I'm sure that a lot of women are watching and they're just like me. They're also excited to get a lot of knowledge from you today. So how do you diagnose for this kind of condition?
Okay, the why the patient in question or the person in question or the couple in question, because I like using couple because it's not a problem of one person. The two have to be together. They need to see doctors together. So there should be proper evaluation and counseling. That's number one. You counsel them, evaluate them, and let them know what they've come for. That's where you start from. Proper evaluation and counseling before you go into text. So for the woman will go for text. The doctor will want to start with the lowest. He can start with high vaginal swab, urine culture, show whether there is infection, because infection is one of the causes of infertility.
Okay.
Chlamydia causes infertility.
If not treated. If
not treated, yes. A lot of STD causes infertility if not treated. Pelvic inflammatory disease causes infertility if not treated, which we call PID. Okay. It causes infertility if not treated. So the woman needs to see a doctor with the husband. So the doctor will send her for those tests. He will also send her for pelvic scan. Okay, to see if they have fibroid.
Okay.
Is there any other thing? The doctor will also send you for transvaginal scan. Is there any polyp, cervical polyp there that is preventing the entrance? Is there any? He can also send you for HSG, hysterosalpingogram, whereby he will find out is there tuber blockage. So it will, all these tests will help the doctor to know where the problem is coming from and what needs to be done. He will also check the male. He will tell the man to do scrotal scan to see if there is any varicose there. He should also do sperm counts, urine culture, and sperm culture also to make sure there is no infection. They will also go for STD test also, VDR test, to check if there is any sexually transmitted disease. So with that, they will be able to find out where the problem is coming from and be able to work on it.
Wow. Okay, let's go on a short break. We'll be right back. We'll go on a short break now. Health Watch continues in a moment. Stay with us. You're welcome back. If you're just joining us, the program is Health Watch, reaching you from your number one station, NTA Lagos Channel 10, the station for excellence. And our topic today on the program is infertility in women. My guest today is still on set in person of Dr. Jane Nwokedi. You're welcome again. Once again. Before we went on the break, you said a whole lot. You talked about causes and the types, and in fact, you went further to talk about the causes even in men, and because the focus is on women today, and you made us to understand that the two must work together because they are a couple. Sometimes you also mentioned where sometimes both of them could be suffering from infertility issues. Now the question that comes to my mind is, infertility in a mother, could it be hereditary for the daughter? And I ask that question because we've seen a situation where probably the mother suffered that, and you find that the young woman gets married. She also sees herself in that predicament. What would you say? Is it linked? Is there any factor?
And we'll have a genetic factor, we'll have a thyroid problem that runs in some family also that affects fertility. Thyroid also affects fertility. We'll have genetic factor. Even in men, we'll have genetic factor whereby a man produces antibody that kills his own sperm. Yes. Have genetic factor. Autoimmune.
You know why I asked this question? I could remember I'd seen a Nollywood movie where the woman had so many children, and so this young daughter of hers was getting married, and so her husband was so excited, and he mentioned that, oh, I heard your mother gives birth to children, men and women, so I would love to marry because I'm going to have men, boys and girls. So that's why I had to ask this question.
We'll have genetic causes too. We'll have genetic causes. So, but it can only be dictated by a doctor. Okay. It might be a minor thing that all of them, the mother has been neglected, that caused infertility for her, and then the same minor thing the child has been also neglecting, that is also causing infertility. But we have genetic factors also that causes infertility.
All right, doctor, let's talk about the treatment options.
Okay.
Like I said in the beginning of the program, I mentioned the fact that we find ourselves in a country where people they live in denial.
Yeah.
You tell them you have this, oh, I reject it, I cast and burn. And because we know that even God expects us to do some things for ourselves as human beings. And interestingly, we have people like you in the society today. So what would you say are the treatment options for women that are going through this?
Okay, the treatment options are many, but it starts with us. One, it starts with us. You have to eat right, balanced diet. Don't overdo anything. The exercise, okay? Don't overdo anything. You know, when you exercise too much, it's not good. You stop smoking, you stop drugs, you stop taking prescription drugs that are not prescribed by a doctor. You know, people don't even know that NSAIDs like non-steroidal anti-inflammatory drugs like ibuprofen, Fervin, they causes infertility. So it's one of the causes of infertility. And you see in our society whereby drugs are not regulated properly, everybody goes to chemists to buy drug without prescription. Somebody will walk in, they will mix Fervin, mix ibuprofen, mix and give them. They take it anyhow. It's one of the causes of infertility. So that's why I said the treatment starts with us. First of all, you know how to eat balanced diet. Don't take drugs anyhow. It's not every drug you see you put in your mouth. You quit smoking. If you are taking alcohol, you quit alcohol, because those are the causes of infertility. If you are stressing yourself too much, you reduce. Everything is about moderation. You reduce. Because there is no way we won't say there is no stress in the country. So it's just moderation. Okay? Then you see your doctor and run the laboratory investigations you need to do. Okay. That's the first step. Then when that is done, the doctor will choose the treatment plan for you. We'll have the medication plan. There are up to 4 treatment plans. So whereby the doctor will give you drugs to stimulate ovulations for you. If your problem is that you are not ovulating, the doctor gives you drug to stimulate the ovulation for you, okay? Then you can go for IUI, intrauterine insemination, whereby your doctor will collect the semen and do the insemination for you on your ovulation day. So you can go for IVF, in vitro fertilization, whereby the doctor will harvest your eggs and the semen and put it in a dish and they fertilize. We'll have different types. We'll have intracytoplasmic insemination. This one is done by embryologist, a specialized embryologist, whereby he collects the semen and injects it directly to the harvested eggs. So the person can take in. We'll have third party treatment. The woman might not be producing enough eggs, or she might not be producing eggs, so she can get a egg donor. That's a third party. Then the man might not be producing good semen, he can get a semen donor.
Okay.
That's a third party. Then we'll have surrogates. Somebody that will help you to carry the baby. That's another method of treatment. So we'll have different method of treatment. You need to see your gynae once you're having a problem with infertility. Once you get married and you stay 1 year and you are not able to conceive and you are doing the right thing, don't wait to say, let me wait for 10 years and be praying. While you are praying, do the needful. It's very important.
Absolutely.
Yes.
Absolutely. Well, thank you so much, Doctor.
welcome.
Before you go, very quickly, what's your advice to women, and of course, what's your advice to men? I know that the topic was focused on women, but you touched a lot of places affecting men, and you also made it very clear to every one of us that the couple has to work together. So it's not a situation where the woman goes to the hospital without her husband. She has to go with her husband, and both of them have to be checked. So what's your advice?
Okay, if you are having inability to conceive, infertility problem, you should see your doctor. The couples should see doctor, not just the female. The couples, because why we are having delay in African country is because we believe it's a woman problem. It's the problem of the women. No, it's not. It's not a woman problem. So the two people have to go. It might even be the man that is the cause of the infertility. So they should go and see the doctor. Don't focus on herbs. They should not be focusing on herbs. You know, African country will like taking herbs. Everything is herbs. And you know, these herbs has different concoctions in it. Okay? So you see your doctor knows the best for you.
Wow, thank you so much, Doctor. We've been speaking with Dr. Jane Nwokedi. She's an infertility specialist, and you will agree with me that she has done justice to this topic today. We are coming back on this topic, especially for the men again and the couple as well. But today she really made a lot of expository insight for the women. Thank you so much for coming on the program.
Thank you for having
and you're
me
coming
on your
back.
show.
And you're coming back on the program. Thank you so much, Doctor.
Thank you for having me on your show.
And that's the much we can take on this week's edition of Health Watch. If you ask me, I had a great time, and I know you did as well. In fact, a lot of things to take home today. If you have any issues at all, if you feel there's something wrong, see your doctor as a woman. Don't see your doctor alone. Go with your husband. It's a couple thing. It's not the issue of my wife is my wife. No. It's a couple thing, because both of you must win together. You need yourselves to have a baby. And on that note, if you have any comments, any questions, there's a topic you want us to treat, send a mail to okibinkem@gmail.com or send a text only to 07060865487. Remember, like I always say, health conscious people live longer. My name is Nkem Okibe. See you next week.